stage biotech. It's up 370% this year alone. The company's lead drug, Resinab, is a treatment for various chronic inflammatory and fibrotic diseases. It's currently being considered and studied in four different phase 2 trials, including one for cystic fibrosis. And investors are pretty stoked about the drug's potential, but they've sent the stock pretty much soaring to the stratosphere. Just yesterday, we learned that it was granted orphan drug status by the EU. Now, Corbus first came on our radar screen when I got a call in August in New York, just a couple weeks ago. And while this is a very small, very speculative company, the kind you should only touch with money that you maybe have to afford to lose. Remember, because I'm saying it's speculation. I still think it would be intriguing, especially if the phase 2 trial results expected later this year turn out to be positive. So let's take a closer look with Dr. Yuval Cohen. He's the CEO of Corbus Pharmaceuticals, and I want to learn more about his company and his potential wonder drug. Again, speculative situation, but we'd love to find out more. Dr. Cohen, welcome to Mad Money. Thank you so much.
Thank you so much for having me.
And I had to put the caveat in because the stock's up a lot, because typically we have larger companies, but I'm going to turn the floor over to you because you're doing some amazing things, and I want our viewers to know what you're up to.
So Corbus is a 2.5-year-old company, and our focus is unique. We focus exclusively on a small family of diseases that are typically very rare. They're actually orphan diseases. They only have tens of thousands of patients in the United States, but they're diseases where the effect on the patient can be devastating. So what's called the morbidity is severe, and sadly these are diseases that are either life-threatening or actually terminal. So one of our diseases is a genetic childhood disease, cystic fibrosis, and I know that's a cause that's very close to your heart.
Absolutely.
And we work very closely with these patients, and of course with the Cystic Fibrosis Foundation, which is just an extraordinary group of people.
Right, and I think people should know that they do not give $5 million grants to everybody. They are very selective and are very rigorous in terms of what companies that they give money to.
We are delighted with the award that we received, and that award has two aspects to it, in fact. The one, of course, is the non-dilutive financing. That's really important. But as you said, it's not money from just anyone. It's money that's coming in from really the premier group of people that are specialized in this field. And I think the credibility that comes with that is important.
But there are other phase 2 trials going on for other different indications.
Correct. So CF is our first one of our diseases. The other three, Jim, are all rare autoimmune diseases. So they belong to the big family that sort of arthritis would belong to, except they are rare. They are sadly very life-threatening, and again, the effect on the patient is devastating. The first one, which I think has a lot of eyeballs on us for that disease, is a disease known as systemic sclerosis, but people may know it as scleroderma.
Right.
Mostly women, mostly in their middle ages. Their immune system one day starts to attack the body. Their body transforms and changes. Their quality of life goes down really dramatically. And sadly, the mortality rate in this disease, for which there's absolutely no drug approved, can be as high as 80%.
Okay. Wow. All right. Also, I know that you just got good news the other day, which did cause the stock to spike, that we should talk a little bit about.
Correct. So part of our focus, as I mentioned, are orphan diseases. And when you, in the orphan disease space, there are a bunch of things that happen that are different to other diseases. One of them is a recognition from the government or different authorities that what you're doing is special. So we have orphan designation and fast track designation in the US from the FDA, but the other day we also got orphan designation for cystic fibrosis from the EU, and that's very helpful.
Now, do you have an indication for, I'm going to mispronounce this last one, I'm sorry, but systemic lupus erythematosus?
SLE, much easier, absolutely. So lupus is actually our largest disease. It's still an uncommon disease, but if you combine our 4 diseases, so we have cystic fibrosis, we've got scleroderma, we've got a disease called dermatomyositis, another autoimmune disease, and lastly lupus, you actually reach a population size in the Western world of close to 800,000 patients.
Okay.
Now remember, these are all rare or orphan diseases, and that's really different.
The last thing I want to just ask about is
Sure.
the synthetic cannabinoid. Do you have the ability, or is there a way to be able to think about one of your drugs as perhaps being anti-pain something?
So the drug actually belongs to a class of synthetic molecules that traditionally are analgesics. They make pain go away.
Right.
Except this drug is very odd. It's actually an anomaly. It behaves the opposite of a lot of the rest of the class. It has no effect on pain whatsoever. In fact, it failed as an experimental pain drug. But what it does do very uniquely is the ability to interact with the immune system and take very heightened inflammation back to normal. And that's exciting because no one's ever managed to do that. This is a completely novel mechanism of action.
Now, you've done some financings, but right now, currently, you suspect that you have enough cash to be able to get through your
Correct. We
trials?
have enough cash to get through all 3 data sets.
Well, that's terrific. Well, again, I want to emphasize to people, this is, to me, a very exciting company. It was brought to us by a caller, and I'm so glad that Dr. Yuval Cohen has been brought on the show to be able to tell the story of Corbus Pharmaceuticals. Stick with it.
Thank you so much.